Hi, my name is Austin Highland. I'm from San Diego, California, and I'm an insurance agent. That's what I do for a living. And I met Dr. Malek in 2016. He's a yeah.
Good morning. I'm Dr. Malek. I'm a neurointerventional radiologist, and I practice in San Jose. I'm involved with three stroke programs, and I met Austin back in 2016, and we have been going through um, his problem of CSF leak, and we have had multiple procedures during that time, and we thought about um, kind of doing this and putting it on film, and so other people can see what he went through and potential solutions. And it was Austin's idea to, hey, let's film this and let other people know about what I went through and how we treated it. So here we are.
Yeah, and then do you kind of just want to let everyone know what a cerebral spinal fluid leak is?
Sure. So cerebrospinal fluid leak is a problem that I think is way underdiagnosed. It's on the literature, it says 500,000 people, but I believe it's a lot more. I think a lot of people are diagnosed instead of CSF leak with maybe migraines, maybe sinusitis, maybe other causes of headaches or
Tension headaches, right?
tension headaches.
Tension
Yeah.
headaches, a big one.
So the big thing that you know, textbook description of cerebrospinal fluid leak is when a severe headache that you lay down, it gets better, you stand up, it goes away.
Mm.
And I wonder, how was it for you? How was your
Yeah, so yeah, mine was kind of I had like these basically intense pressure headaches. So anytime would stand up, I'd have like extreme kind of like a pressure pain, neck pain, shoulder pain, and then nausea and vomiting was very common. And it's just like when I would lay down, it would subside.
and how long after you got up you got the pain, you got the symptoms?
Pretty like within like I'd say like a minute or 2 minutes.
And your symptoms were every day, all the time?
Every day, all the time.
Okay. For how long did you have the symptoms?
I had these. So it first started in 2013. What ended up happening, I jumped off a cliff in Hawaii, and I landed at like kind of I think like a weird angle feet first, and I hit my back on the water, and it's been pretty high. And then from that day on, I had just these intense headaches, and I didn't know kind of what they were. So I went to a neurologist in San Diego. They put me on like I think like Elavil for headaches and different types of medication for tension headaches, but like none of it helped at all.
Sure.
And I kind of thought I felt like I was going like crazy because I had these headaches and like no one really knew what was going on, and so it was kind of a weird time for me because I just gotten into college too, and that's kind of a fun time where you're drinking, doing a lot of fun stuff, and I'm just kind of like bedridden really. I mean, like Nick's the guy who's recording this was one of my best friends, and like I really didn't hang out or do anything fun just because I was in so much pain like constantly. And with these CSF leak headaches, they're very debilitating. But I mean, on the outside, everyone thinks you're fine.
Yeah.
But it wasn't until Andrew Blumenfield, he's a neurologist in San Diego, he suspected that I might possibly have a CSF leak. So I think it was 2015 in January before my 21st birthday, I got my first blood patch, and it was a blind blood patch, and it actually worked. It was done in the ER, and I was good until around 2016 of March. I started having the headaches again. I went to Good Samaritan Hospital in San Jose because I was working for Coca-Cola up here in San Jose. I got another blind ER patch. It didn't work. I ended up going to a neurologist up here as well. I think his name is Dr. Ahmed, I believe.
Mhm.
He's a neurologist. Gave me a bunch of medication, gabapentin, Soma, tried Botox, all these types of things for these headaches, but it didn't work at all. And then that's kind of when I got referred over to you in 2016. And I think we had my first procedure in June of 2016. And yeah, just kind of want to talk about like the type of procedure you do because I've had so many blood patches. I've had so many types of imaging, MRI of the brain, spine, digital myelograms, and none of that imaging ever showed like a leak actually, like suspected areas, but no definitive leak. So none of the type of blood patches, the blind blood patches, or even targeted blood patches at certain areas where they suspected the leak kind of worked until you do this type of procedure that you do.
Sure, sure. And that's a very typical story, as you know. So people have severe headaches, meningismus, neck pain, nausea, vomiting, mental status changes. People can't think straight, as you had that too, I think. Um, and to find the diagnosis has been pretty difficult. So we do MRIs, we do CAT scans, we do myelograms, we do nuclear medicine that you inject some radioactive stuff within the fluid and try to look for the leak. So let's go back to what is CSF leak. So CSF, cerebrospinal fluid, is a fluid that surrounds the brain and the spinal cord. So around the brain and all the way down to the tailbone is this fluid that cushions the brain and also does some nutrient, bringing and, removing some of the toxic stuff. So when the fluid leaks out, the cushioning effect goes away. So brain kind of sags. And that's possibly why we get the symptoms where the brain is kind of not getting the cushioning effect. If the leak is lower down along the spine, I feel like people get more of the symptoms of when they're standing up straight, more fluid leaks out. When they're laying flat, the brain is also more relaxed position. There's no pressure on it. So first time this whole thing was described I think by a German neurologist back in 1930s, 1938, I believe. Then it was described by a Mayo Clinic physician back in 1950s. But the challenge is people like you that we don't find the source of the leak. Most of the people who have leaks have the leak exactly where the lumbar puncture happens. LP lumbar puncture happens and you know exactly where the hole is because they try to remove some fluid from your spine by LP or sometimes by epidural. If they go a little bit, few millimeters further in, they puncture the dural matter and then the CSF could leak.
But mine was kind of just caused by like trauma. And that's some people have CSF leaks caused by like trauma.
Correct. Okay. Yeah. So the trauma ones are also, if it's head trauma, is not something I would deal with, but it's also a big, huge challenge because CSF is leaking out the ear or nose or throat. And, ENT physician would look inside or people taste this salty fluid coming out. And that has to be surgically fixed if it doesn't heal itself. And a lot of times body obviously heals itself. So when we do lumbar puncture, also we know exactly kind of within a level or two where the other person went in. So we go to that level, we put some blood, and we call it blood patch. What does blood do to seal the hole? We don't exactly know, but I think it's maybe blood causes clotting and then fibrous tissue, and it's right exactly where the hole is. But I feel like there's some stem cell kind of, regenerative stuff going on because when you put blood there, all the blood products help the healing process because the dural matter doesn't have much blood supply. So what do we do for CSF leaks? It's way understood why it happens and how we heal and treat the process. But the first thing you hear from doctors that know about this disease, which is minority of doctors. I mean, ER docs hear about it because you show up in the ER. And some of them do blood patch, and one of them did one on you successfully, which I'm amazed and hats off to him that he did that. Most ER docs wouldn't adventure doing that. The other things, bed rest, taking caffeine helps, laying prone.
And that's the hardest thing though. Bed rest helps and caffeine helps, but taking a lot of caffeine and laying down isn't it's kind of a hard thing to do because when you have caffeine, you want to go, but you're just laying down and your heart's racing and stuff. So
yeah, that's interesting. That's interesting. Yeah. So most of the time it goes away by itself. Within a few days, within a few weeks, you lay down and it goes away. So when my patients call me, I tell them to do that. And I try to get them to, a few days of comfort. Pain pills help, but they're not helping greatly. I don't know how it was.
I took a lot of like Norco and stuff like that. And it kind of, it helps a little bit, but not really. It's just masking the pain. And nothing, no medicine I've ever taken really has,
But it's also affecting your mentation.
Oh, yeah.
Norco also
Yeah.
makes it even worse for going to work.
Oh yeah, no, it's harder to work. Yeah, and like one of the things that cerebrospinal fluid leaks do is like that constant pressure headache. It makes it very hard to concentrate and focus and retain new information because you're just in so much pain, and kind of all you can think about is how much pain you're in constantly. Yeah.
So why does blood patch work? We don't know exactly, but I mean, the way I explain it to myself or makes sense to me is we put your own blood in outside of the tear. That's the goal. So if we know where the tear is, we put blood there. Blood clots, forms scar tissue, and brings with it all the pluripotential cells, kind of stem cell thing, because the dura don't have much blood supply. So this dura matter, when it tears, there's a tear, but there's not enough blood products or stem cells kind of to heal that process. So we put some blood there and it heals it. And we were talking about this earlier, and I think a better way to do lumbar puncture is actually do lumbar puncture and put patients' blood outside of it a little bit. And that's something I think I'm going to start doing. So the challenge is there are thousands of patients like you that they go through MRI with contrast, MRI brain with contrast, MRI brain with contrast. Sometimes you see the dura meninges are lighting up because they're inflamed. You get myelograms. You get myelogram with CT.
And these are all very invasive. Like digital myelogram is one of the most invasive procedures I've ever done because is it called incubate you or whatever, and they put you under, so put the tube through your mouth. And that digital myelogram, I think with my insurance, I think it cost me like $1,200. So like a lot of these people too, I think, they don't have the financial means to afford these kind of imaging and stuff. And thankfully I was, living with my parents and stuff, so I was able to kind of, pay for these medical bills. But it's very expensive to get that kind of imaging done.
Yeah. And it's a challenge for physicians. It's a challenge. You have gone to a lot of doctors, and people have tried different things. I think I've gone to UCSD, Cedars-Sinai.
Another UCSD, Cedars-Sinai, another neurosurgeon in San Diego as well. So I've gone to,
And Cedars-Sinai is one of the best places for this. They have a great surgeon that does this, that does open surgery, and they do great maneuvers like what you said. They actually put a catheter in the, and they increase the pressure in the CSF, and they try to find the leak. And DSA is basically digital subtraction, is X-ray that subtracts out the older image because there's a lot of bone there, and you try to find the little leak there, which I have done, but I would tell you that probably 4 out of 5 or maybe 9 out of 10 cases, I don't find the leak.
Yeah.
And if you find a leak, problem becomes very easy.
Very easy to solve, yeah.
So you either do blood patch. If blood patch doesn't work, you can do fibrin glue, which is a little stronger, theoretically, or the surgeon goes in and sutures it if he can find it, but you need to tell the surgeon exactly where the hole is. They can't open the entire spine and look for, the leak. So it is a challenge. So, share with us. It's your experience.
So let's go into a little bit the type of procedure you do, because I've had so many failed blood patches that were targeted blood patches, fibrin blood patches. None of those ever worked for me.
Sure.
But the type of blood patch that you do has worked for me every time.
Sure. So I think I did one blind one for you that didn't work.
That didn't work,
every time, we did a different procedure. So what I've done, and this was first described by Dr. Onotari, I believe, in Japan. But I have been doing it before that, but I've not published anything. But it's and it seems like we have parallel done the same procedure. There's a group in Michigan that also has described this procedure. We use different catheters, different wires, different stuff. What I did that made sense to do in somebody like you is I go through a little hole in the back, in the lumbar spine, in the lower back. And most of the leaks that we don't find are in the thoracic or cervical thoracic junction between the neck and back, especially in trauma or otherwise. So I go through a little hole, I pass a tiny catheter, tiny like, angiohair spaghetti, kind of fine, 1 millimeter or smaller. Go through the spine, I'm in the fat space behind your spinal canal, outside of the dura mater. And I give the patient a blood patch from mid-neck all the way down to the mid-lumbar spine. So it is a shotgun approach, but it has worked, I think, for me every time. And the other few papers that are out there, this group in Michigan and this group in Japan, they report 80-90% success. And it's interesting, similar to your story. I've had patients that have been bedridden for 5 years. They have not come out of the house. They are horrible. They're depressed. Depression is a big thing that you were mentioning. And it works most of the time. And I have to say, to my surprise, because, and the risk of the procedure from my series and, a few other things are on the literature, nobody has had a major complication. I haven't had any complications, but I can tell you there's no risk. Now, we have talked about it every time before doing your procedure, that there hasn't been thousands of this done or hundreds of this done, but the procedure is quick, maybe half an hour procedure time. I go through a little hole, you get a Band-Aid, you come out. So let me explain, as simple as I can. It's pretty simple, what I do for this procedure. And it just made sense. That's why I started doing it. And at the time I started doing it, I didn't find any literature on it about doing this. So anesthesiologists do sometimes epidural catheters for pregnancy. They do epidural, for pain, for childbirth. So I had done that. So the not knowing where the leak is, I didn't want to put 8 needles in you all up and down every place and try to do blood patches.
Because that would take a lot longer too, right?
It would take a lot longer. It's painful. It's uncomfortable. The thoracic spine is the angle of all the bones and spurs and, spinous processes are challenging to get a needle there, and challenging to get a needle exactly in the epidural space, because epidural space goes in a triangular way posteriorly in the back. So I went into one level in the low back, which is easy to get to the epidural space. Then I use catheters, wires that I use in the brain. I go fix brain aneurysms with, and I went all the way up, and I could make my way up to the mid neck, cervical spine, and then I give you a blood patch all the way down. I give the patient a blood patch, and I kind of gauge I want to make sure the patient doesn't have any symptoms, because if I put too much blood there, the nerves get impinged upon and you feel it. And I think one time or a couple of times you felt it.
Yeah, I definitely feel it.
So it's kind of a shotgun approach for giving you epidural blood patch everywhere.
But like why it works so well too is just because a lot of times, like with the imaging, the leaks could be so small that they don't show up on imaging. So this approach, basically, by putting like 60 cc's of blood, is kind of a blind approach, but it's covering your whole spine. So if there is a leak, there's a good chance that it seals it.
Yeah, and I think most of the leak, from my experience, are in the thoracic or lower cervical spine, which this covers it. And this is exactly where it's hard to get a needle in otherwise. And I think it's way underdone, way underdiagnosed. Part of the challenge is, we have talked about this, that this procedure is kind of lost between the specialties. Who does this procedure? I think neuro-interventionalists would be most likely to undertake this. Neuro-interventional, and some people are surgeons or neurologists or radiologists. Initially started with radiologists because of catheter skills and willing to do this procedure, because it requires you to go into the fat space and navigate this catheter up and down. So tell me your experience. Initially, how long it took for your headache to go away? First time you had it?
The first time I had it. So once I had like my first successful blood patch, after you have that blood patch, you're very, very sore. Your back's sore, but you start to feel. Probably, I'd say 1 to 2 days you feel a little bit better, and then at the 2-week mark is where I really, start to feel a lot better. But the hard part is once you have this, procedure and stuff, you basically need to lay down for almost 48 hours. That's what I do, just to be safe. And I don't lift anything over 5 pounds or twist for like 2 weeks because I've had, I returned kind of to working out and sports a little too early, and I kind of blew the blood patch. So I'm really just kind of cautious, and there's really not any like literature out there. Like if you look like, what they give you at some of the hospitals, they just say, oh, just lay down for, 24 hours and then you can return to normal activity. But I definitely don't think that's the case because it's, I think the more time you give the dura to heal, the better.
Yeah. And we don't know the answer, but
Yeah.
it's probably lifting heavy weights is not good. And you were working out a lot, and I remember at least once you came back because you were lifting heavy weights again.
Yeah, no,
and you heard it pop.
And I still do like lift heavy weights, but I just kind of, I'm limited on what I can do. I don't do heavy squats, heavy deadlifts, anything like with my legs. I don't know why it is, but I just don't do it just because it brings back these headaches. Yeah. I don't know the science behind it or anything like that, but I just know like for me, in my case, there's just certain limitations, I have.
Yeah. And it was interesting that you had a blood patch that worked, but then you went to other doctors and they gave you medicines and they gave you pills and you did, still the diagnosis was missed, even though you were like, I had this pain, I did this procedure, and pain went away. So
and the thing I've told you is I feel like I know more than 95% of doctors in regards to CSF leaks, and I'm sure anyone out there who's listening who's had a cerebrospinal fluid leak knows how often misdiagnosed it is. And then also just how like you feel like you're the expert in the room because most people, when they think of blood patches and stuff, they think of pregnant women who had an epidural who's, they just give a blood patch at the target area where they gave that epidural and then it's fixed. But for someone like me, it's not like that. It's caused by trauma and it's just a very misunderstood thing.
Yeah, the challenge is we don't know how many people are out there like you.
Because I know that you said that stat too, 5 in 100,000 people suffer from CSF leaks, but I'm sure there's probably a lot more people that are just misdiagnosed and they don't know that they have a CSF leak and they have one, and the doctors are going to haven't been able to diagnose it.
Sure. What studies have you had so far?
So I've had an MRI of the brain.
MRI of the brain.
MRI of the brain without contrast. MRI of the spine. Without contrast.
Without contrast.
I've had spinal taps. I've had 2 digital myelograms. What else have I had? I've had
nuclear medicine.
What was that?
Nuclear medicine.
No. Yeah.
Nuclear medicine study you had.
Yeah. Mm-hmm.
So all of these studies, you look up and down spine, and you're trying to find the leak. You put contrast in the spine, in the CSF fluid, and you try to find the leak. The problem, we have great imaging. We have 3 Tesla MRIs. We have CT scanners that are like 256 slices. But unless the leak is significant, we don't see it, unfortunately, which is a problem. And all these studies, you get scheduled. It's 2 months from now or weeks from now, and you do it, and somebody interpreting it. It's challenging.
And I've also noticed too is that one radiologist looks at the imaging and sees a completely different thing than someone else.
Yeah.
And that's what I've kind of noticed. So I don't know if there needs to be like some standardized way that you kind of view these imaging stuff, but I've seen like different radiologists have seen different things that other ones had not. So I don't know what that.
Yeah, because the signs are not black and white.
Okay.
Usually they're not black and white findings. Yeah, I remember you called me from San Diego. You were like, I was going to do this procedure, that procedure, they're going to do this, and we talked about it, and you had a couple of procedures there that didn't work.
And I think I I just want to go, because the last blood patch I had successful from you was 2017 until last year, but I kind of just want to go into my story of kind of how it all happened and kind of the effects that CSF leaks have on like mental health as well. So, from 2017 to 2020, I was kind of just living my best life. I was in the best shape of my life. I just bought my new 2 new insurance businesses with my longtime girlfriend about to propose, and kind of everything, was perfect. And June of 2020, I started having these headaches again. And I was in San Diego, you're in San Jose, so I'm like,
did you do something to bring it on, or just
no, it's kind of just spontaneous. No trauma, or no it wasn't like times before where I lifted a heavy weight and it kind of came back. It was just came back, and I started having this nausea, these crazy headaches. But what happens is with these cerebrospinal fluid leaks is, what it does is they're debilitating. You have these insane pressure headaches, you're throwing up every day, that nausea, neck pain, shoulder pain. And what it does is it just isolates you from like your friends and family because you're just bedridden. And then it's also just hard, like in my business, you know, I'm an insurance agent, so I'm supposed to be social. I'm supposed to talk to people, you know, do that kind of stuff. And all of a sudden, I'm literally just unable to, you know, golf, unable to play basketball, unable to work out, kind of all my stress relievers. So all I'm doing is just working and sleeping, and just in pain constantly on Norco, on a bunch of different, you know, pain medicines. They actually even gave me Zoloft to basically treat my depression. But my depression was, I'm not just a depressed person by nature. It was a situational type thing, still very real. I mean, still very real. But like, I think one of the problems that I've kind of, you know, have with like the medical system and stuff is just that doctors are so fast to just prescribe like a medicine without actually getting to the root of the problem. And something I like, what I really love about you, Dr. Malek, is that I didn't get to experience this whole last year with all these, you know, all these different specialists I went to. It really felt like it was just a business. Like, how fast can we, you know, get you in and out of there? And none of these doctors had like good bedside manner. But for you to, I mean, like after I had my procedure, you texted me from like your personal cell phone just to see how I'm doing. And that's a big thing. Like, you know, having a doctor that seems like they actually, you know, care. And that's a big thing with, I mean, patients when they're suffering from all this and they just feel like they're going crazy, to have, you know, someone be like an advocate for them is just very refreshing.
Yeah, and thank you for coming here, to pushing for us to have this communication and telling me about Facebook group and every other online group and people that are suffering from this. I mean, I haven't published this. I've given a few talks about this. This procedure doesn't even have a name. You're calling it a high volume, but I've thought about an acronym to make a name for it. And people have called it different things, but basically we're doing a blood patch in the entire spine. With one puncture hole site. So I'm glad it has worked for you.
Oh yeah, me too. I mean, I can't thank you enough because you've given me my life back. I mean, I know it was all in kind of God's hands, but He really, I think, I don't know. I thought my life was over. I was depressed. I was suicidal because I thought this was my life. I'm never going to be able to do any of the things that I enjoy to do. And when you get like depressed like that, and when you're in chronic pain, what it makes you kind of develop is like a victim mentality. Like, you're the only one suffering from this. You're the only one going through this, and you just start attracting like all this. Like, when you put out that kind of stuff into the world, that negativity is kind of what you attract. And I thought my life was over, and then I had this blood patch, and now my life is back to normal. It's better than it's ever been. I actually proposed to my longtime girlfriend in January, and just everything's kind of like it's better than my life has ever been, and it's all kind of happened from just seeing life kind of like a lens of gratitude, and just seeing things that everything happened for a reason. You kind of grow through what you go through, and that to anyone suffering from like cerebrospinal fluid leaks, that knows that there is a solution out there, but you just have to be patient. And I would like I've dealt with this from 2013 to 2021, so I know a lot about all of this. So I would love to just if I could be a resource, and help you, lead you in the right direction to get help, just because it does get better and these headaches do go away. It just takes time.
Yeah. So let me describe the procedure for people who are hearing it. What to go through. So the procedure is probably for you as a patient. The difference is maybe 5 minutes, or maybe I don't know. Some people it depends on how long it takes to do the blood patch. This just takes a little longer, and you're going to be a little bit more sedated. So the way I do it, you get an IV, you get sedation. For a blood patch, you may not get an IV and no sedation.
And I think that sedation helps too, just to make sure like you don't move at all. Yeah. Right? Yeah. It makes it a lot easier because when you...
Most of the sedation is to relax you. Because you don't know. You're putting a catheter.
Oh yeah, and it's kind of awkward when you're laying on your stomach or whatever. And it's an awkward type of procedure as well. So that sedation does help.
Yeah. So procedure takes less than an hour, probably half an hour, maybe a little more, a little less. Afterward, we don't know, but I think lifting heavy weights is not good. Doing exercise or
twisting, golfing is not.
Probably at least for a week or two, taking it easy, a couple of days of laying
Yeah.
laying down, relaxing, probably helps. And I've been really surprised that it works on almost everybody that I really thought they have a CSF leak.
Yeah.
So one of the challenges with this, how do you tease out the CSF leaks from people who are diagnosed with migraines?
Mhm.
Because most people do have the, textbook, they lay down, the headache goes away or gets better, they get up a few minutes later, a few hours later to get the headache. A lot of people get diagnosed instead, with orthostatic hypotension.
Mhm.
They stand up, their blood pressure drops, that's why they get dizzy, and sometimes headache comes with it. And I think people with long-standing CSF leak or intracranial hypotension, low pressure of the brain, also get orthostatic hypotension. Their pressure drops also when they stand up. So I think there's some relationship there. But the procedure is easy. The imaging is complex. As you said, the radiologist would look at it and somebody says there's something there, the other person says there's not there, whatever. I think if you do the imaging, it suggests low pressure fluid around the brain, brain sagging, there's some signs. Meninges enhance when you give contrast, the lining around the brain, which pia mater is one of them, is the last one that holds, I think if there is enough suggestion, CSF leak, and there is no site of leak that surgically could be fixed or targeted, we could do a blood patch. I think it's worth trying this procedure.
Oh yeah, because the alternative is having like a CSF leak headache, and you can't live your life with that. It's so debilitating.
Yeah.
There's people who, like you were even saying, like were bedridden for 5 years and stuff.
Yeah.
And I was very bedridden too. All I would do is lay down and sleep, and it's just a continuous cycle of, you just get depressed because you're just laying in your bed all day, and it's just, that chronic pain is just, it's horrible. And it's like when you're going through it, people just don't understand, because you look fine on like the outside and stuff. And even doctors, when you go to, they'll just say, headache, take an Excedrin, take this, that, but it doesn't actually fix it. And so that the type of procedure I think that you do, it's 100% worth the risk. If it worked 2 out of 10 times, it's worth the risk, because the alternative is living with those headaches, which is horrible.
Yeah. I think it's misunderstood. A lot of times, people in my specialty, we do brain aneurysm, fixing brain aneurysms or rupture, or stroke patients coming, we pull the clot out of the brain. And so we think this is not that important. Somebody just has a headache, so we don't pay attention to it. So a lot of my colleagues, 99+%, that if you go to them, they probably don't want to spend time doing this. They all have the expertise to do it. It's what I'm doing is not that complex. I can teach anybody, who does what I do. But we spend our time doing stuff that we think is more important. But this, has a lot more damage to your lifestyle and somebody's life than
in the CSF leak community, they call these headaches suicide headaches, because so many people have cerebrospinal fluid leaks. It goes misdiagnosed for so many times, and they end up, killing themselves because they don't think there's an end to these headaches and the pain that they're in. And
you turned me on to a couple of the sites. I've been reading them. I haven't posted anything, and I'm realizing it became evident for me, like how much people are suffering from this.
So I think and I'm sure, we'll post, like when you post this, we'll post like resources to you in your office and all that kind of stuff. And to me as well. And we can definitely kind of hopefully lead people in the right direction, just because, from my experience and your experience, we do know a lot, kind of about CSF leaks.
Sounds good. Thank you so much.
Yeah, thank you so much, Dr. I appreciate it.